Are you preparing to have a baby and you're wondering how long are you going to bleed after you have a baby? This is the video for you. I'm going to be breaking down what is the bleeding timeline as well as what are signs that maybe something is going amiss and we need to seek help. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be breaking down what is the bleeding timeline that you can expect after having a baby, what is normal, and what is maybe signs that we need to seek help after we have that baby. Postpartum hemorrhage is one of the leading causes of maternal mortality within the United States and across the entire world. This is just bleeding heavily postpartum. It can happen immediately, which is an immediate primary postpartum hemorrhage, or we can have a secondary postpartum hemorrhage or a delayed postpartum hemorrhage that can happen within the first month or so postpartum. It can be really scary because most of those times this is at home that it's occurring. So it can be really helpful to know what is the normal postpartum bleeding timeline so you can see when are things maybe amiss and maybe we need to reach out to our providers. There are 3 different stages within the postpartum bleeding timeline, and it's important to know vaginal discharge for the bleeding timeline is called Lochia, and your providers might bring this word up every once in a while, but it is Lochia, just refers to the bleeding and the discharge during the initial 4 to 10 weeks is the range. So you can have postpartum bleeding for 4 to 10 weeks. Where is this bleeding coming from though? The bleeding is coming from 1, lacerations maybe within your vagina that happen during birth, like within the vaginal canal, as well as the vulva, labia, any of that. All of that takes time to heal, as well as where the placenta was embedded into your uterine wall. When it comes off, it's still very vascular behind, so all of those blood vessels need to clot up and kind of create a scab in a way where that placenta was located. And then this goes through different varying stages of healing, just like if you would have scraped your knee on the ground, that needs to go through the different varying stages. And that is mostly what you're seeing in vaginal discharge. So the different stages of Lochia is number 1, Lochia Rubra, Lochia Serosa, and then Lochia Alba. Lochia Rubra is the first stage, and this is where you're going to have the bright red to dark red bleeding. It's going to be heavier, similar to a menstrual period, and this is going to be the one that we're most familiar with. This can last for up to 5 days, sometimes a little bit longer, but for most of us, it's going to last between 3 to 5 days. And this is, again, that dark red to bright red bleeding that's heavier. We might have some clots in there. As long as the clots aren't associated with gushing of blood or increased bleeding with the clots, and they're just every once in a while and particularly smaller, no longer larger than a golf ball size, ideally, then they're fine. We're just going to keep an eye on it. If you're having those bigger golf ball sizes or orange sizes sometimes, and it's associated with increased bleeding, those would be reasons to reach out. This again, 3 to 5 days. After that, we're going to move into the next step of Lochia Serosa. This is more of the lighter spotting type bleeding. It's way lighter, not as heavy, as well as it might be a little bit brown or maybe more pink colored, as well as it starts to kind of go into more of a yellow color. And this is just from that wound within the uterus healing. During this timeline, though, there is something called eschar. This is where the scab from where that placenta was comes off. When the scab comes off, you will have an increase in bleeding that might be for 1 or 2 hours, and then it will return back to the bleeding that you were previously having. This typically ranges between day 7 to 14. Every one of us kind of hits a different one. Majority of us, it's around day 10, but it can be as early as day 7 or as late as day 14 that this eschar or the placental scab comes off. The reason we have that increased bleeding right after is because once the scab comes off, there are some blood vessels still behind that scab that cause a little bit of a gush until it fully clots off again. As long as that stops, that heavier bleeding stops after 1 or 2 hours and doesn't pick back up again later, then it's not concerning. You can always call your provider and most likely they'll just reassure you that is a normal finding and it was just that eschar. The serosa bleeding, again, can happen from day 5 until about day 21 postpartum. So it can range for quite a period of time, 2.5 weeks, the serosa stage is. And again, it's going to start more of that dark red, brown red, turn more into the pink and into the yellow. And most people might not even notice the next stage, which is the Lochia alba. This discharge is a little bit more yellow, almost whitish, and this can last for pretty much the rest of the time period. So this is from like week 3 to week 4, 5, 6, all up until week 10, depending on your body. And this is, again, just the final stages of wound healing. And once that vaginal discharge kind of stops, then you're out of the wound healing process of that placental location, and you're out of that initial recovery period after birth. I say initial because there's still other things that we need to recover from. Things that we would be concerned about for this bleeding timeline. I've already said them a little bit, but if you're passing any clots larger than a golf ball size at any point, that is always alarming. So just to be on the lookout for other things that we're noticing around that clot. If you're having increased bleeding that maybe is starting to pick up a little bit more around those clots, then reach out to your provider. If you have a clot, but no increased bleeding, no nothing, it could be completely normal. The other thing is how often we're changing our pads. We normally recommend changing our pads at the beginning period every 2 to 4 hours. And this is because we want to keep an eye on how much we're bleeding. If we're saturating a pad, a menstrual pad, and I mean saturating it like filling it in 1 to 2 hours in the initial postpartum period, that is concerning. It might not be such heavy bleeding that you're like bleeding, it's running down your leg, it's really heavy. It could just be the slow trickle of constant bleeding over time that is saturating that pad in 1 to 2 hours, and that's still concerning for us. So any bleeding that's heavy, like running down your legs, gushing out of you, or you're saturating a pad in 1 to 2 hours, those are both reasons to call out to your provider to be assessed for a postpartum hemorrhage. Whether you're in the hospital still or you're at home, call your provider because that is definitely concerning things that we're looking for. Throughout the wound healing process, you might notice like slight odor changes as you get through the different stages. But if it ever is so foul, as well as maybe you're having a temperature or any like weird, like maybe a green colored discharge or like pussy type discharge, those would be signs that potentially there might be an infection, and reaching out to your provider for that as well can be helpful. So just to recap the bleeding timeline, there are 3 different stages: Rubra, Serosa, Alba. Rubra is like the first weekish postpartum. This is the heavier bleeding, bright red to dark red bleeding. Then we move into Serosa. That's like week 2 and 3 of bleeding. This is more, starts maybe a little bit brown into pink and then into yellow. And then the last stage of Alba, where it's more yellow into white discharge. The entire process can take between 4 to 10 weeks, depending on all of our bodies. Some of us, it's closer to 4, some of it's closer to 10. Again, we're all individuals. Signs that are reasons to reach out to your provider is if you're filling a pad in 1 to 2 hours and you're passing any clots, as well as having potential any signs of infection, of a fever, any redness to touch potentially on your laceration or episiotomy if you have that, foul discharge, or even like funny colored discharge, all reasons to reach out to your provider to be assessed. If you're wanting us to create a video on any specific topics during pregnancy, birth, postpartum, newborn, let us know in the comments below and we'll be sure to make a video. If you enjoy this video and want to learn more from us, please subscribe to our channel. We try to release 2 to 3 educational videos and 1 fitness video every week. If you are pregnant and postpartum and you want to learn more from us in our paid courses, we do have an online childbirth education course where we break down the science of labor and birth to include labor positions, labor comfort techniques, what your partner can do to support you during birth, as well as a postpartum preparation course where we discuss what is happening to you in the first month postpartum, as well as a newborn portion where we discuss what to expect for baby in the postpartum, because Google is there, but we don't want to rely on Google for some of these medical type questions. We really prepare for pregnancy and birth, but sometimes we forget about those postpartum periods. So we have both offerings to help you prepare for both transitional, life-changing moments within our lives. And if you're wanting to learn how to move during pregnancy to have a strong and pain-free pregnancy, we also have prenatal fitness programs as well as recovering after birth with postpartum fitness programs. And we have different bundles available for you. And as a thank you for watching this entire video, you can use code YouTube10 for 10% off any of the offerings that we have on our website at mamastayfit.com.